Hi there, this is Jamie SHIINE, and I'm the director of the SHIINE program. I'm a program specialist here at Long-Term Services and Supports in the Pierre State Office, and I'm going to talk to you a little bit today about my program SHIINE, which stands for Senior Health Information and Insurance Education. First off, I always like to start off with my family because you're going to see a lot of me as you get started. I do some in-person trainings that you're invited to come and attend, and so you'll get to see me present quite a bit. But just to get to know me a little bit, you'll see in the far right corner, this is my husband, Buddy, and I. That's at our wedding reception in Minnesota, and I'm a big trap shooter, so we're just having fun on our wedding reception day, I guess. We did that on a different day than our wedding. And then there's our three kids. There's Lily to the right, and then Maya to the left, and then Grayson in the middle. They're at this time, they are 9, 5, and 1. And they're just quite a joy in Buddy and I's life. And then our fourth child is our dog Lucy. She's a big part of our family and is 9 years old as well, and that's her playing in the snow. So it's just a little bit about me to make this a little more casual. Now on to the SHIINE program. We are actually a grant-funded program. We don't receive any state funds to provide services across the state to educate Medicare beneficiaries. We get them all our funding through a federal program called the Administration for Community Living. That's under the Department of Health and Human Services, which also administers several other pots of our funding here at Long-Term Services and Supports. They also administer Medicare, Medicaid, Social Security, and many other recognized programs. Then we administer those grants that I receive right here at the Division of Long-Term Services and Supports at Department of Human Services. SHIINE's mission is to empower and assist Medicare beneficiaries, their families, and caregivers by providing free, in-depth, one-on-one insurance counseling and assistance, and educating them on how to prevent, detect, and report healthcare fraud, errors, and abuse through outreach, counseling, and education. I always think that might win the world's longest sentence, but that is about as in a nutshell as you can get for describing the SHIINE program. The organizational chart for SHIINE, just to put that into a little bit better perspective, we already talked on how we get the funding through the Administration for Community Living. That's an agency within the federal government. Then we receive that funding through Department of Human Services, Division of Long-Term Services and Supports. And that's where I work, and so that makes us co-workers. And we do work closely on helping you guys assist people with their Medicare concerns. From there, most of the funding that we receive gets distributed out to 3 regional offices. We have contracts with Active Generations in Sioux Falls. We're in the Sioux Falls office. Tom Hoy is our Eastern coordinator. And then in the central and western areas of the state, we hold a contract with Eris LLC that is owned and operated by Debbie Stengel, who has been a SHIINE coordinator for about 8 years. And she has regional managers who assist her in servicing the central and western areas of the state. In central South Dakota, the SHIINE office is managed by Roger Ward, and he is located in Pierre at right above the PARS building. That's Pierre Area Referral Services. They're right on Garfield and Franklin, the corner of that, and you're always welcome to come visit them. And then there's in western South Dakota, we have Leah Karsrud, who manages the western office in Rapid City. They're located actually in the mall, and they're right near Zales and pretty close to the AARP office. And it's a nice location for our office and staff because they're also the Social Security Administration office is also located in the mall. So it makes it a high traffic area for servicing seniors. And that's actually where Debbie is located out of as well. So, and then our Eastern office, we already said Active Generations. That's a senior center in Sioux Falls, South Dakota, and their office is located just nearby the Active Generations building on the corner of 46th and Western. So they have a nice little office there too, and really any of the offices you're welcome to visit, and please keep them in mind as you service and you help Medicare beneficiaries. They can help you a lot with the questions that you have. And then from there on, we spread ourselves deep. Our roots get spread deep into the rural areas of South Dakota through many volunteers and partners. And we consider the LTSS staff a partner of the SHIINE program. And we want to make sure that we are supporting you with fundamental Medicare knowledge, since it's all the consumers that you serve usually have Medicare, and so it's good for you to know this information, and it's good for you to know that we're here to help you. So that's the basics there. And we already mentioned how we have staff and volunteer counselors statewide who are assisting people, and we want to make sure it's very clear that we're doing these services free of charge. We operate under the sole funding of our grants. And this is just a nice little map of those 3 different regions. Next slide is showing you the contact information for each regional office and the counties that they're serving. You can contact them anytime via phone or email, or even just swinging by the office. So we want to make sure it's very clear that we are an unbiased source of Medicare information. We're not going to be affiliated ever with any company that sells or distributes any kind of insurance product or service. We're committed to within our scope of work and our mission of providing free and confidential and unbiased information to all of South Dakota's Medicare beneficiaries. We have volunteers, and they are a very important aspect of the SHIINE program, and we're always looking for volunteers and in communities, because that'll not only builds our credibility within communities, but it also provides a local face that people are already comfortable with. So if you know of anybody or know of any partners that would like to help people with their Medicare questions, please have them reach out to our regional office, or let our regional coordinators know that there is some interest, and we would love to reach out to these people. So you guys have referred several volunteers to us in the past, and I always want to keep that door open and let you know we're always looking, and we'd love any leads that you would have for a good volunteer in your neck of the woods. So as you help people with Medicare, Medicare tends to be an extremely complicated topic. People don't understand it, and they end up getting frazzled and confused quite easily. There are many, many options for these beneficiaries to choose out of, and all in all, we give them, when we help them with their Medicare questions, we give them understanding, reassurance. We help them understand their options and feel comfortable with their decisions. And not to let it go unsaid, but we also save them a lot of money and a lot of time for trying to navigate this on their own. And then same thing, we also have a lot of caregivers and family members who are helping their parents or loved ones with their Medicare questions and hurdles. So we also help them by lessening their guilt, saving their money. Maybe they don't have to travel as much, and we're helping them understand something that maybe they weren't in their time of they aren't quite in their time of life to try to look into what Medicare means, and you're helping them comprehend something that is quite difficult, and they really appreciate it, and we find that SHIINE is a very valuable service within all of South Dakota's communities, and we're always looking, like I said, to keep expanding that. So just a little touch on the basics of Medicare. Even though within your training agenda you're going to find that I have included a bunch of Medicare basics online training in that itinerary that you have. This is just going to give you a little bit of a scope in my wording. We also invite you to attend an in-person training to cover the basics of Medicare for South Dakotans, because the online trainings are really a nationwide service that we are subscribed to. And I welcome you to any of our trainings just to help understand it better. So the basics of Medicare. Medicare is our nation's health insurance for individuals who are age 65 and older. And it's also opened up to individuals who are disabled, and that you would qualify for Medicare because of a disability when you are receiving Social Security disability benefits for 24 months or longer. Starting on your 25th month, you would be able to be enrolled into Medicare. There's a couple exceptions to that. One of them you'll see listed here is end-stage renal disease or permanent kidney failure. There's another exception to the waiting period, and that is for ALS or Lou Gehrig's disease. Those are the two exceptions to the 24-month waiting period. So this is what Medicare looks like if I were to just show you, open up my brain and show you about Medicare. Medicare is made up of several different parts, and it's been really added to over time. So each part has a very different flavor, and that really adds to the complexities of understanding what Medicare is all about, because it's not like every other kind of insurance out there. Medicare originated in 1965 with Medicare Part A for hospital insurance and Medicare Part B for medical insurance. Part A is for inpatient care when somebody is admitted into the hospital. A lot of people call Medicare Part A free, and it is premium free for about 95% of the nation's population. And Medicare Part A is really paid for by you. As you're working, you contribute to Social Security and Medicare with your working dollars through your FICA taxes. And so that is a prepaid benefit. And if you don't have the 40 quarters of Social Security credits that you would need to get free Medicare Part A, it's the same amount of credits you would need to draw from on your spouse's record to get Social Security benefits. If you don't have that, it would be about $423 a month just to have that hospitalization coverage. Then there's Medicare Part B. Medicare Part B is $134 a month for most Medicare beneficiaries. Now, if you have higher income, you may pay a higher Part B premium. And you also there are assistance programs out there that could help you pay that Part B premium, and that's through Department of Social Services, our state Medicaid office. But Part B, what that covers is clinical visits, outpatient hospital, more like an observation status. It covers some preventive health care services. It also would cover durable medical equipment like wheelchairs, walkers, assistive devices like that. And Medicare Part B premiums, that $134 a month, is taken out of your Social Security check. But both Medicare Part A and B, they are not free. And that's a common misconception. So those, in addition to the Part B premium, Medicare Parts A and B have co-insurances and deductibles that can make Medicare quite expensive for people. In a nutshell, people pay about 20% of those costs. Medicare picks up 80% and they pay 20%. And so what happens is a lot of people would need some help with those bills, because 20% of a medical bill can be quite expensive. So people like to level that out by getting additional insurance, and that's called Medicare Supplement Insurance or Medigap insurance that covers those gaps that Medicare Parts A and B do not cover. So people will pick up a Medigap plan, pay a premium, let's say anywhere from $90 a month to several $100s a month, and that would cover those gaps depending on which plan they have. The government back in the 90s, they standardized the Medicare supplement insurance plans. So they labeled them letters A through N, and don't be confused with A, B, C, D of Medicare. They really like their alphabet, I guess. But plans A through N offer a variety of different extra coverage to support the costs with Parts A and B. So we do have some really nice shopping tools out there. They are sold by private insurance companies, and we do shop around and get people a general quote so that they can shop by price, because remember that coverage is standardized, so it's the same. So every plan G would cover the same things that every other plan G would cover. So people are just shopping by the cost of the plans, not necessarily the coverage of the plans. And then there's Medicare Part D, which was added in 2006, and that's to cover Medicare beneficiaries' prescription drugs. Medicare Part D plans are sold by private insurance companies, and it's a very competitive market. In fact, about 80% or about 70% of SHIINE's work is done during what's called the open enrollment period, which goes from October 15th through December 7th. And during this open enrollment period, it's the time when the prescription drug plans communicate what prescriptions they're going to cover, what pharmacies they're going to network with, and what those rates are when all things are considered. It's the consumer's time during that open enrollment period to shop around to find the best suited plan for them. We recommend that people do not just pick a plan and stick with it for several years. We always say just take a look every single year, just in case if there's another lower cost, better fitting plan that covers all your medications that's available for you the following year. In fact, when we do that, we saved last year $3.4 million for Medicare beneficiaries just by helping them take a look at the options. So it's an extremely important thing to do, because these insurance plans are so competitive. So that we do use your help during that open enrollment period from October 15th through December 7th to help educate Medicare beneficiaries and the consumers you serve and get them in to get their plans compared. We also provide instruction for them to do it on their own, but we're willing and able to help with our whole network of volunteers and partners out there assisting people with their prescription drug comparisons. And then there's another option that was brought about in the 1980s, and it was Medicare Part C. This is for Medicare Advantage plans or Medicare health plans. Brought to us by Congress as an alternative option to original Medicare, those other parts you see to the left. And Medicare Part C or Medicare Advantage plans, what they do is they get a stipend from the government each month. It's about $850 to $950 each month for every beneficiary they cover. And what they do is they take on the risk of insuring the beneficiary. Now the Part C plans that a beneficiary enrolls in usually has a premium, especially the ones in South Dakota. The person would also have to pay their Part B premium, which remember is $134 this year. And what these Part C plans would is they would provide the same coverage as Medicare, but they can change up the cost of the coverage. So people would find a lot of times that the premiums are fairly low, but then as they need to utilize the insurance, the cost would go up depending on the services that they need. Now, Medicare Part C plans are not a one-size-fits-all, and individuals need to be very careful when enrolling into a Medicare Advantage plan option. They want to make sure, first of all, that it works with their network of doctors and providers and healthcare professionals. They want to also make sure that if it has prescription drug coverage, that fits them well. And they want to also look into the future to see if it would be an appropriate plan for them if something were to happen. For example, if cancer runs in your family and you prefer treatment at, let's say, the Denver hospital, you would want to make sure that plan would cover those kind of services if that happened, because you are limited to those networks. And we have a lot of tools about all different parts of Medicare and transitioning onto Medicare to support you in educating people. And like I said, a lot of our staff just refer people to the SHIINE program, and that's just fine. If you feel comfortable with any areas of Medicare and want to help educate consumers as they ask you questions, please feel free to do that, and we'd like to support you with that as well. So a reminder once again is there's an open enrollment period from October 15th through December 7th. That's actually an open enrollment period to take a look at your prescription drug plans, as well as, I didn't mention on the other slide, but your Medicare Advantage plans as well. And we are out there in full force helping people determine which plan is the most appropriate for their prescription needs and that works with their pharmacy. Please, once again, reach out to us if you need help. If you want to locate a counselor in your area, we do have a map on our website. Our website is www.SHIINE, and that's shine with 2 I's, .net. And you can find help in your area by clicking on any county in our map. I mentioned before that we do provide some training so you can become more familiar with Medicare, and one of the things would be our Medicare Basics training, and that is held online. We do have there are two lessons that we have you look at, and they do take quite some time, but they're broken up into very digestible pieces so you could take them here and there. And then we also do an in-person portion of that training to talk about Medicare in South Dakota and the ins and outs of SHIINE and how we help you. So that's located during the summer months, typically in June, and you can find that information by going to SHIINE.net and logging into it's a volunteer login is what it is, but it is for all volunteers and partners. And then we have a recertification training every year in the fall where we refresh on changes to Medicare and what's going on with the SHIINE program. That's an in-person training that you guys come to, and you can find the dates for these trainings by logging into the SHIINE.net volunteer login. To get a password for that, you're going to want to contact me, Jamie Signer, and my email's on the next slide, and I can get you set up with a password for the online access to our materials, including the listings of our trainings. Just an idea, our trainings are a very comprehensive overview of Medicare, and we educate and train LTSS staff. We also have our partners in the room as well as our volunteers who are all counselors and helping out with SHIINE's mission. We do recorded trainings if you happen to miss one of our live events, and you're always welcome to pick those up instead. Now here's my contact information. If you have any questions, please reach out. I'm excited to meet you, hopefully in June of this year. If that hasn't passed already, maybe I'll see you at the recertification training in the fall. But I look forward to working with you, and I thank you so much for all of your assistance helping South Dakota's Medicare beneficiaries.